Welcome to this presentation on the Parent and Baby Star, a tool for measuring and promoting change when working with parents in the perinatal period. My name's Joy MacKeith and I'm Director and co-founder of Triangle, which is a social enterprise based in the UK that has a mission of supporting well-being through developing tools that enable change. In this presentation, I'm going to introduce you to the Parent and Baby Star, describe how it works and how it's different from other tools. And then I'm going to hand over to my colleague, Dr. Anna Good, who's going to describe the development process and share with you the results of the piloting process and also research that we've done since the publication of the tool a couple of years ago. So I'm going to start off by sharing my screen with you so that you can see our slides. Just to give you a bit of context, the Parent and Baby Star is one of a suite of nearly 40 tools that are collectively known as the Outcome Star. There are different tools, different versions of the tool developed for different client groups and different service needs. So for example, as you will see on this slide, we've got the Justice Star, which is tailored particularly for working with people in the criminal justice system. We've got the Family Star, which is for working with parents across all age ranges. The Drug and Alcohol Star for working with people who have drug and alcohol issues, etc. So the Parent and Baby Star sits within this wider suite of tools. These tools have been around for about 15 years. The first version was one for homelessness, which was published in the UK in 2006. And they're widely used across Australia and also the UK, and to some extent all around the world, having been translated into about 15 different languages. So we have about 1,000 organisations using the tool, mostly charities and public sector service delivery bodies, but also some used by the police, some housing associations, some other sorts of organisations. And as you can see here, we've got a version in Finnish, the Tulisteti, a version in Dutch, Resultatenstaar, Étoile de Progression is the French version, and we also have a version that's being used in Hong Kong. I'm sad to say I can't pronounce the Chinese version. So the key characteristic of all of the Outcome Stars is that they're dual purpose tools that have been designed both to support the keywork process or the casework process, that interaction between the frontline worker and the person receiving a service, and to measure the changes that are taking place for the person being supported through the course of the work. So as you can see in this graphic, for the service user, it's a tool that helps them to get to grips with their situation, to take an overview, to set priorities and to understand what the next step is for them. For the organisation providing the service, it offers a consistent, holistic, trauma-informed and strengths-based approach to key work. And in addition to that, for the organisation providing the service and sometimes for other stakeholders, it provides distance travelled information, which is rooted in the individual work with each service user, but can be aggregated to provide information right across a service or a group of services. So moving on now to the Parent and Baby Star itself. It's designed to be used with mothers and with fathers during pregnancy and the first 2 years of the baby's life. It's specifically designed for working with parents who are struggling with mental health issues. And it was developed in the UK in collaboration with service providing organisations in Hertfordshire, which is a region to the north of London. And it was piloted in by an organisation called For Baby's Sake, that run an innovative new service for mothers and fathers where there's a risk of domestic violence, and it's a comprehensive kind of wraparound service that works in a very trauma-informed way. So the collaboration process, which Anna will say a bit more about later, happened alongside practitioners in that organisation. So what is the parent and baby star? Well, it's basically, this is the graphic, this is the kind of the heart of the tool. It consists of a number of outcome areas. For each outcome area, there is a 5-point scale, and those 5-point scales are arranged in the shape of a star, as you see here. The outcome areas are mental and emotional health. That's the mental and emotional health of the parent who's completing the star. Physical health of the parent, housing and essentials, so the extent to which that person has the housing that they need, and money and essential equipment to look after their baby. Relationship, which refers to the relationship between the mother and the father, or the co-parents, whether they're together or not. Support network, which is looking at the extent to which the parents have friends, family, sort of supportive connections that will help them through the baby's early years. Looking after your baby, which looks at the parent's ability to provide for the baby's physical needs and to support their development. And connecting with your baby, which is looking at that all-important attunement and the extent to which the parent feels that they have a positive connection and is able to enjoy their child and attune to them and respond to their needs. Let's move on to the next slide. So we have those 7 outcome areas and a 5-point scale for each of those. And alongside the star, there are clear definitions of what each point of each scale means, what it means to be at a 1 on, say, the physical health scale, what it means to be a 2 on the physical health scale, etc. The one that you see here is the mental emotional health. And just to give you a little bit brief flavour of it, at point 4 on the scale, the parent might feel that they are finding ways to manage their mental health and their emotional well-being, but with support to do that. There are also more detailed versions of the scale, so you can, the point here is just to show you that there's quite a lot of clarity of definition as to what each point of the scale means. Underpinning all of these scales, there is what we refer to as a journey of change, which is a model of what is the change process that a parent will go through as they make progress on each of these 7 domains. So the brief descriptors that we have for this journey is that at the beginning of the journey, things are not okay. So this means that there are issues in terms of the person's mental health and their ability to care for their baby. But at this stage, they're not getting help, or if there is help available, it's not being provided in a way that they can engage with, or for whatever reason they're not able to engage, recognise that there is a difficulty and that they might need help. The next stage of the journey, accepting help, is where they do feel able to accept help. So at this stage, they maybe don't have a great belief in the possibility of things being different. They maybe don't feel that it's something that they would know how to do to change things. But there is a recognition that maybe they could do with some help, and they are engaging with help that is offered. The next stage, which we refer to as believing and trying, is the point at which the parent feels some sense of belief that yes, they can make a difference here, yes, things can be better, and yes, they can take an active role in changing things. From there, we move on to finding what works. So at the believing and trying stage, they may be just starting to take action, but don't at this point have the skills or the experience or the habits to do things in a different way. Whereas when they move to finding what works, that experimentation process has happened for a little while. They're beginning to find better ways, maybe to support their mental health, maybe to connect with their baby. But at this stage, they're still in that learning process, and they still need support from a specialist service. And there are areas where things are probably still not working quite for them, or they're vulnerable to being knocked back if there's a particular challenge. And then the final stage of the journey, managing well, is where Obviously things may not be perfect, but basically the parent is able to manage the baby's not at risk in any way, and they don't need the support of a specialist service, although like all of us they will continue to need support from their own network and through universal services. So if I just go back, you can see that the scale point definitions are kind of color coded and follow this journey. Things aren't okay, accepting help, believing and trying, finding what works, and managing well. So the way that the STAR is used in service delivery is that as part of the core process of delivering the service, the parent and the worker who's supporting them will have a conversation about all of these different outcome areas. And that won't necessarily be a very structured conversation. It can be quite a fluid, natural conversation, but the scales will help to focus that conversation and towards the end in discussing each outcome area to bring it back to the scales and to think about, okay, well, where are they? Which scale point description most truly reflects where that person is at that point in time? So once the discussion has happened around all 7 areas, the points can be plotted on the STAR. So you will see here the point 2 has been plotted. So that's the kind of accepting help area for mental and emotional health. Same for physical health. 3, which is believing and trying, for housing and essentials. So these points can all be plotted onto the STAR and the points joined up, and that gives you a kind of at a glance overview of how things are for that person, and that is then a good basis for talking about what the priorities are, what the goals are, and for building an action plan. So that would be done, and then the actions would be taken and the support would continue. And then at a point sometime later, it depends on the intensity of the service being delivered, how long that is, but typically it might be, say, 3 months later, the process would be repeated to look at how things are now, have things improved, and for each of the 7 outcome areas there would again be a discussion about how things were, and the points could be plotted on the STAR again. And as you can see, we've got 2 lines here. So we've got the orange line, which would be the initial assessment, and then the green line, which would be a second review, maybe say 3 months later. So what that does is it provides a very another snapshot, which can also be used again to relook at goals and priorities, but it also provides an instant sense of what's changed, where things have changed, how much they've changed, possibly in some cases where things haven't changed, although in this case there's been some progress on all of the outcome areas. So to draw this description of the STAR to a close, I'd just like to give you a sense of what the key features are of this tool and how it's different from a lot of other measurement tools that might be used in this sector and others. So a key value behind the tool is the empowerment of the parents, and a key thing that is different is that the scales focus very much on the person's relationship with the issue that's being discussed. So it's not a severity tool. It doesn't look at the severity of the problem in each area. It looks at how is the parent in relationship to that. So are they recognizing that there's an issue? Are they accepting help? Do they have a sense of taking ownership of that issue and beginning to direct a process of change themselves? Are they learning? Are they developing skills and new ways of doing things that are going to work better for them and for their baby? So that's one of the core differences. Other tools may focus more on the severity of the problem. Another core value is collaboration. So unlike most tools, this is a collaboratively completed tool. So the reading that is a result of a conversation between the worker and the parent, and is designed to be the product of their 2 perspectives coming together. So the parent might feel, oh, it's all terrible, I'm at a 1, and the worker might feel, oh no, you're doing really well, it's, you know, you're almost there in relation to this outcome area, it's a 4. But actually maybe neither has completely the full perspective, and there's a conversation that happens between the two, and out of that a more accurate and more rounded assessment is achieved. And crucially, what people often tell us is that out of that, what's achieved is a shared perspective, which is a really essential foundation agreement for working together. So it's collaborative completion rather than being self-completion or worker completion. And then finally, the final way in which it's particularly different from other tools is that it's a tool that's integrated into the service delivery. So because it's both a keywork tool for supporting the process of change and it's an outcomes tool for measuring the change, the measurement process is embedded within the service delivery and is something that it isn't an add-on. So workers don't experience it as an additional burden, something else that they've got to do that takes them away from their work. They experience it as a core part of their work. So at this point, I'm going to hand you over to my colleague Anna, who's going to talk about the process of developing the tool.
Hello. So the development process for the parent and baby star follows the same set of stages that we use for all new versions of the outcome star. So initially, when we are approached to develop a new version, we would conduct a scoping review with the potential collaborator to confirm that there really is a need within the sector that can't be served by existing tools. If we decide to go ahead, we would then begin a process of conducting 3 workshops with the outcome areas and journey of change refined in between each one. Once the pilot version is available, we train the practitioners in the collaborating organisation to use that version of the star. And then for the parent and baby star, a 6-month process of completing parent and baby star readings with parents was begun, at the end of which we gathered feedback from both service users and practitioners, and also conducted some initial validation work to test the psychometric properties of the pilot version. Finally, we look for the existing literature, scientific literature, in this case about perinatal mental health, to ensure that the journey of change in outcome areas fit with this, and then conduct final validation work on the published version. So I'm just going to show you some feedback we received at the end of the pilot. So service users were very positive about the parent and baby star, with the majority agreeing that it was enjoyable to complete it, and also that the scales helped them to understand what they needed in the way of support. So you can see that in the graphs, obviously, at the beginning of this slide. We also collect qualitative feedback from service users and practitioners. So as you can see, one service user said, "I liked that it made you think and realise where support was needed. It gives you the motivation to make it look better next time." And another said, "It helped me realise where I was with my anxiety. It gave me the options of what I can do with my anxiety." So moving on to practitioners. Again, the majority were positive, and they said that it helped them to understand where to focus next with service users, and also to get an overall picture of a service user's situation and needs. One practitioner said, "I feel that this tool opened up more in-depth discussions than we would usually have." And another said that the wording for the scales opened up lots of conversations relating to the interventions we could put in place. So this is fairly typical of the feedback we receive at the end of pilots for the new versions of the star. So I'm now going to go on briefly to talk about the psychometric validation that I take part in. So for the pilot version, we looked at factor structure and internal consistency. And these are measures of whether the outcome areas hang together as one coherent construct, in this case relating to perinatal mental health. And that did appear to be the case, that the outcome areas were a single construct. We also look at responsiveness to ensure that the STAR is able to detect change that's occurring within the service. And again, there was evidence of responsiveness to this change. There was also no evidence of item redundancy. So that's where we look at the correlations between the outcome areas and make sure that none are so high that it appears that we're repeating the same question or the same outcome area. And then we also, as I mentioned, conduct additional validation work once we have a larger sample of routinely collected parent and baby STAR data. So this was in a health visiting service, a different service to that that took part in the pilot. And again, we were able to show a coherent one single factor structure with acceptable internal consistency, no evidence of item redundancy, and very good sensitivity to change between first and second STAR readings. So in terms of responsiveness, for the published version, we excluded those who could not move forward because they were managing well at the start. And that's why you can see a different sample size for each outcome area. And the effect sizes here were very reasonable. So we've got medium to large and large effect sizes. You can see that the largest amount of change was for connecting with your baby, which obviously would have a strong impact on infant mental health. And so anything sort of above 0.5 is considered a large effect size. And as you can see, the Wilcoxon statistic column, the effects were all statistically significant. Okay, so I'm going to briefly show you some of the reports you can get out of the STAR data. So this first one is a simple overview of where people are entering the service. This can be really helpful to make sure that you're not getting too many people who don't really need to be there. So in this case, you can see there were quite a number of people who were fairly high on the journey of change when they arrived. But that doesn't mean that they didn't have significant issues in other areas. And in terms of change, the STAR can show distance travelled. So at a very high level, you can say how many service users or what percentage move forward in at least one outcome area or two outcome areas. Now, sometimes you may be presenting the data to someone who's not familiar with the journey of change or the STAR. So in this case, this is the advantage of having very clearly defined outcome areas and journey of change stages. You can turn this into a narrative. You're not simply saying there was a change from 1 to 2. You can actually turn this into words. So by saying, for example, that 75% of service users who were not looking after their health progressed to finding ways to be healthier. Okay, and in this graph here, this is showing the percentage of service users moving forward, staying the same or slipping back. Importantly, we've actually differentiated between those who stayed where they were, who were at managing well at the start, which is obviously a really good thing, as opposed to maybe not so good when you're staying at lower stages of the journey of change. So the light green bar shows those who were staying at managing well. Okay, so just to wrap up with a couple of quotes from practitioners. One said, the STAR helps to check in with parents about where they are in their lives with their baby and with relationships and support. It keeps their goals in focus and alive. And another said, the STAR gave me an opportunity to explore every area of her life relating to her unborn baby. I feel that this tool opened up more in-depth discussions than we would normally have. So it's incredibly valuable in sort of looking at the links between different areas of someone's life and making sure that nothing's missed. And it really does help to have a really good and thorough conversation with service users. Okay, so if you would like to find out more, please get in touch. We have the Outcome Star website, and we also have specific service providers within Australia. So Unique Outcomes can be contacted, their email address provided here. Yeah, we would love to hear from you if you have any questions or feedback. Thank you very much for listening.